All right. So, good evening, everyone. Really happy to have you here for our June Community Convo. Again, every month, Vital Connections comes together with the community to share information around different health topics. So you get to know who's doing the work, how to ask questions, and where to connect you or your family and your community to resources. And I'm really excited about this month because we've got two really great community members who are leading and making sure that LGBTQ health is prioritized in our communities. I do know these two individuals that'll be joining us tonight. I see their work. I've seen their heart. It's definitely in everything that they do. And I know that this is going to be a great opportunity for us to lean in, ask questions, and have a better understanding of how, if we are looking for resources and we identify as LGBTQ individuals, or if you know someone who does and you know that they might need help connecting to community or getting resources or healthcare that honors who they are, this is a great place for you to be too, as a supporter, a family member, a loved one, an ally. So I'm really excited about this conversation because I know being in community with these two folks that you're going to hear from tonight, I've learned a lot from them. They've also been great friends. So I'm really happy to just have you all be a part of the conversations that I know that I've had since I've met them. And they've taught me a lot. And now I know that I feel so comfortable being able to connect other folks that I know to the things that they need and just show how you could be an individual and a human to make sure that everyone is healthy and has a healthy future. So before we get deep into the convo, I do definitely okay, it's good to see everyone on the screen. All right, we got some shout outs here. Hi, Maria. Um, so first, I'm going to introduce you to our two speakers.
Hello, everyone.
Hey, Maria, how are you? So
I'm just ducky. Thank you. And how are you?
good,
And
good.
everyone else?
Yes. Maria, thank you once again for coming to another convo. So, we are here with two great community members who are leading community organizations and in the health space to make sure that folks are connecting to the resources and healthcare that they need and deserve. So I just want to first, before we get into like our formal introductions, I know one of our speakers is going to really give like a deep dive about the work that's going on at one of the most well-known health centers here in Boston that cater to LGBTQ individuals. And that's going to be Adrianna Boulin. She she is phenomenal. She's got a great haircut, a great smile, great energy. And is also the director of social justice, equity, and community engagement at Fenway Health. So first, I want to give the floor to Adrianna just to give a quick overview of some of the work that's been happening in Boston, especially at Fenway, to kind of just give you a grounding for the conversation that we're going to have today. And then after that, I'm going to bring on our second guest, and then we're going to just have one large conversation about LGBTQ health here in Boston. So Adrianna, I'm going to pass it off to you.
Thank you so much, Ayana. Hi, everyone. Welcome. Thanks for joining in all the ways that you are. I'm so happy to be in community with you all. My name is Adrianna Boulin. I like hearing it Adrianna, as long as you respect me. And I use the pronoun she and her. And I'm going to share a bit about where I work, Fenway Health, and how it connects to what's important to me and what's important to us, and how we bring that into the world through our mission in the organization. And if there are questions that y'all have along the way, if you can add them to the chat, and I think there will be time towards the end to generate questions, so I invite you to hold them. And I'm excited to dialogue with you all and share what I have to share and also learn from you. So I'm going to share my screen. And I just want to invite you all to share if you can. Actually, I don't want to share that screen. One second. Can you see my screen, my shared screen, my PowerPoint slides?
No, we just see
Yes,
your
it
background.
says Fenway Health.
You see Fenway Health slides?
Yeah, no, not the
Yes,
slides, just the
it just
background.
says Fenway Health.
What do you see now?
Okay, that's a slide.
Okay,
Our
okay.
history.
Thanks for confirming. So Adrianna Boulin, she, her pronouns, Director of Racial Equity, Social Justice, and Community Engagement at Fenway Health. And a bit about our history. So we started in the early 1970s. Really motivated students wanted to create a free clinic movement, and they did in the basement of one of their buildings to really create the kind of care for the people around them and the people they loved that they weren't seeing, especially individuals that were living with HIV and suffering from AIDS.
Your figures speech.
Our mission, and I want to invite someone appears to have not be on mute. If possible, if you can go on mute, that would be great. Thank you. Our mission, the mission of Fenway Health is to advocate for and deliver innovative, equitable, accessible healthcare, supportive services, and transformative research and education. We center LGBTQIA plus people. I'm gonna break that down. That is lesbian, gay, bisexual, transgender, queer, intersex, asexual, plus. Plus can go on. An example of what's in the plus is pansexual. That happens to be my sexual orientation. So that is the LGBTQIA plus. I can share more if there are questions. BIPOC individual, just as Black, Indigenous, people of color, and other underserved communities. So that's anyone that experiences disadvantage and marginalization, to enable our local, national, and global neighbors to flourish. So that's our mission, that's our charge, our way forward. Some of the things we're committed to, we are committed to being anti-racist. And what that means to us is to intentionally identify the inequities that exist in our services for the people we reach, in the places that we foster for our employees, and what we hope to achieve in health outcomes. We are committed to centering equity, which means asking the question what people need to get what they need, centering that lens to how we work as an organization, how we deliver care and services, and how we engage with our community and support our teams. That's what we're committed to at Fenway Health. The culture that we create. I love talking about this. I grew up learning about the platinum rule, which is treating others as they wanted to be treated. And at Fenway, I learned the golden rule, which is treating others, we learned about the golden rule. That's what we grew up with. And at Fenway, we focus on the platinum rule, which is treating others as they want to be treated rather than treating others as you want to be treated. You know, we always hear that, but sometimes you as an individual want to be treated differently than somebody else. Maybe respect looks different for you than it does another person. And so at Fenway Health, we create a culture where all employees have the right to openly be who they are at any given time. And it's important to us that we socially affirm our colleagues' identities to the extent that we know, and we make space to know, rather than making assumptions, really creating a space of curiosity to understand who's around us. And catering to people in their first language. Accessibility is so important, and it supports how we're able to connect and interact with each other, and engaging with cultural humility and respectfully across identities is the norm. So cultural humility is accepting that we don't know everything about everybody, but being responsive to the differences and nuance that we all experience as people. Something that we use at Fenway Health that I love to create spaces where anybody joining in community in that meeting or space can feel empowered and respected and received and valued as a part of the purpose or intention of that meeting. And I'll read off of these Brave Space principles, happy to share them in detail with others if you're interested, but they're agreements that we make with whomever we're in meeting space with to ensure that we can all participate and engage in a thoughtful and meaningful way. So I'll read them aloud. They're welcome multiple viewpoints, own your intentions and impacts, work to recognize your privileges, take risks, take space and make space, notice and name group dynamics in the moment, actively listen, challenge with care, confidentiality, and break it down. And I love these because we invite people to review them and identify which one they might want to lean into. And it helps create a space or a structure that we can all agree we can function within and be our best empowered participatory selves. Last phase of the conversation I want to go into is some of our acknowledgements and the oppressive systems that we fight against at Fenway Health and how we do that. One is racism. Racism is a system of advantage and disadvantage based on race. When you look at racial inequity across the United States in different systems, it looks the same. And even if there is a difference in socioeconomic status or your income or access to housing, there are still inequities based on race. We still see different disadvantages based on your racial identity. And there are a lot of people who, in addition to having a racial identity that exposes them or makes them more vulnerable to disadvantage, there are other identities like being LGBTQ or being unhoused or having low income that compound on the experiences and create more that someone has to navigate in being their best well self. Sharing this map as an example of racism as a public health crisis or substantiating why it's a public health crisis, the map on the left shows rates of COVID-19 in the cities of in the neighborhoods in Boston, and you'll notice the areas that are a darker yellow show higher COVID-19 rates, and the areas in lighter yellow show lower. The map on the right is a racial ethnic breakdown of residents throughout Boston, and what's interesting here, or it's interesting to see that the areas where COVID-19 is higher are also areas where we see more Black and Latine folks living in the map on the right. So that describes how race can be can be a system of advantage or disadvantage. Individuals of the Black and Latinx race experience poor health outcomes for COVID-19. And you see this in many other conditions related to health as well. This is just one of many examples. At Fenway Health, we acknowledge this. We acknowledge that this system of disadvantage and advantage of oppression exists, and we disrupt what we can to address it so that we can have better health outcomes for our patients, a better environment for our staff, and we can deliver better on our mission. And one way that we did that was creating a racial equity action plan. It was a 5-year plan that we came together with members of the community and staff to think about what it looked like to move towards anti-racism, which is an ongoing process, a journey. I don't think it's a journey that will ever stop, but what it looks like to accomplish that through all of our systems. And I have a screenshot of it here that talks about what we do at our board level, what we do to support our managers, our supervisors, our leaders, how we engage with community. We thoughtfully thought through what it looks like to be anti-racist throughout our organization and how we deliver our services. And we're moving into our almost third year of our 5-year process now. And look out for community sessions where we can talk more specifically about that. I wanted to highlight this for you all because one of the things that we do to assess equity is to ask ourselves 5 key questions. And these questions are framed as our racial equity impact analysis tool. But these are questions that we can ask of to assess any kind of inequity. And whether there's a question of practice or policy, we ask, who are all the people who are going to be affected by this decision or policy, and are they at the table? And once you ask that question, it's how will this decision or practice impact all of the groups who are affected by this? And then the remaining questions give you an opportunity to think about how you'll involve who's not at the table, how you can mitigate or prevent some of the impacts or all of the impacts that can happen based on what you're deciding or what practice you're putting on, and then what changes you'll make based on all the responses to those questions. So these 5 questions are just an example of what it looks like to think about how a decision or practice or policy impacts a group. Addressing racism as an organization helps us cultivate belonging and meet health equity needs for all people. And quick mention of some of our action groups at Fenway Health that exist on the screen to support us in our work: a racial equity action team, a health equity task force that focuses on data to determine what we can do better as an organization, a racial equity action team for our board to support at that level, and a council that involves all of us in thinking about our shared goals and moving forward equity priorities. At Fenway Health, we are a federally qualified health center, and we, in addition to having these services and care, conduct research, education, training, other programs, and policy and advocacy along this continuum of care, and really looking out for all aspects of the individual that I mentioned earlier, LGBTQI plus individuals. Here are some of our programs, and more can be found on our website at fenwayhealth.org. And I invite any questions that you all have about what you might see up here. And I'll also put my email in the chat for folks that may have more specific questions. And that is Fenway Health. And I hope it inspired some thoughts and questions, you all, and thank you all for listening in on it.
Thank you, Adrianna, for sharing a bit about Fenway Health. I do know that there are a lot of great folks who work there, who not only support the mission and, make those connections, but they have a great team of doctors and practitioners there. And again, you see all the work that Fenway Health does. And just to be explicit, you don't have to be a member of the LGBTQ community to go to Fenway Health. They take care of everyone. So, when we're talking about all-inclusive care, this is definitely a space that if you are looking for that support, Fenway Health is just a great option. So I just wanted to highlight that, and just want to say thank you for all the work that you're doing to create that environment for care in Boston. So thank you so much for that presentation, Adrianna.
Thank you, Ayana. And we're accepting new patients too. So if you're exploring new providers, just to let you all know, I'll drop that in the chat as well. Thank you for highlighting that, Ayana.
All right, so thank you. All right, so let's get into our conversation. I think that was a really great way for us to set the stage and kind of give you a bird's eye view of some of the work and the history of what inclusive care looks like in Boston. And I know with the work that Fenway's been doing over the past couple of decades, definitely wanted to set the stage with that. And then even while the presentation was going on, I know that there were some questions about, certain, identities. I just want to name up top, this is a safe space. If you are curious or you have questions, this is a space for you to ask. Of course, respectfully. And we know that sometimes with our first draft and maybe not knowing how to ask the question, you may hit a hurdle or fumble, and that's okay, because we're here to listen. So that way, listen with intent, so that way we can better educate, right? we're all learning from each other. So I just wanted to kind of, set the stage there, that this is an opportunity for you to ask questions and get to know what you need to know. Because I know there's a lot of times where we're not in space where it's like, oh, I don't know if I should ask that. I don't know if it's correct. But I do know, I know from personal effects, talking to Adrianna and Curtis has been really helpful with just getting to know certain things just so that I'm comfortable, just as a friend, as an ally, so I know how to better stand in space with everyone else. So I just wanted to kind of name that there before we get into the conversation. But here we go. We're going to start this convo off now that we've got our foundation. So I am going to get this virtual stage going. Let's see. Okay, thank you. Thank you, Marquis. Oh gosh. All right. So Adrianna is back. Of course, Adrianna is from Fenway Health. And now joining us, we have the executive director of the Boston LesBiGay Urban Foundation, Curtis Santos. So Curtis, thank you for joining us tonight as well.
Thank you for having me, Ayana.
Yes. So Curtis, I know that we heard a bit about Adrianna and the work that she's doing. I definitely, before we get into some of the questions that we have, just wanted to give you a space to talk about the work that you do with the Blue Foundation.
So thank you for, well, you know how my normal greeting is, what's up, family? I think we get into space.
Remember, this is a combo. Feel comfortable. Talk how you talk.
Every time we get into a space together, it's like family. And I think that, family educate each other, family uplift each other, and family really try to understand what's going on around each other. So anytime I get into these spaces, I consider everyone family, because we're on the page of learning with each other. So I am the executive director of Boston LesBiGay Urban Foundation, in which we are a social service agency that work within the LGBTQIA plus community, really serving the inner city community. And I really like to highlight that, right? Because a lot of folks really don't serve the inner community intentionally. And I think that for us, we're really serving the Dorchester, Roxbury, Mattapan, Hyde Park, JP, wherever you at, we serving you. We're serving you. And our goal is to really uplift so many different service provisions. And I want to shout out to Fenway Health, because they are partners of Blue in this work of creating healthcare and providing access to care and understanding what's happening around services in healthcare. But some of the service provisions, I'll just hop into it really quick, Ayana, and I'll turn it back over to you, is we have our reentry program, which is called Blue Care. We work with folks who's coming out of the pen, out of the correctional facilities, and working with them on mutual aid and getting them back to society. We have a mental health component, which we offer free mental health services to community members, and they don't have to identify LGBTQIA plus anything. And I think I want to really make that known, because we don't know who identifies as what. We want to work with populations, right? And I think that sometimes it's us trying to figure out who's LGBTQIA is hard enough, right? But just to serve an individual, you get to know them, and naturally they'll be coming out to you and say, this is who I am, and you can serve them better. Some other functions that we do, we have our mentorship program as well. So if you guys have any queer identifying individuals between the ages of 14 to 18 or 19 to 24, please let them tap in with us. We have a BIPOC mentorship program that looks like us, identifies as us, and walk the talk as we talk and walk as us. And, we don't usually see BIPOC queer mentorship programs out here. We see Big Brother, Big Sister, which is I don't want to say this out loud, but it's like whitewash, right? Where our community don't feel included in some of those service provisions that they do have within Big Brother, Big Sister. So please connect with us. Let's connect with you, and let's really make some work happen in the city. And I'll turn it over. We have a lot of other services that we do, like 25, 35 of them. But I'll turn it back over to you. If folks were looking to learn, I'll drop our website in the chat, and folks are definitely going to the website, check out some of the service provisions that we do offer. And please, please, please do reach out, or have a young person reach out to us to access services. And I'll turn it back over to you, Ayana.
Yes, thank you for, that good introduction. You also have, let me just say, first of all, you have two great people in the room outside of the health space. They are leading and creating community. Adrianna recently led Pride for the People that put on the phenomenal Pride Parade this past weekend. So just want to shout out to you. because I know after a while it had gone away and now it came back. And it was just a big celebration that I know a lot of people were looking forward to and were participating in. So I just want to give you a shout out there because you started off Pride Month with that great celebration. And Curtis is going to close it out, right?
Curtis is involved all up. Curtis is the lead of our QT BIPOC Advancement Committee on Pride. So like, I also want to rope Curtis into this. Like, we have such a huge group of dedicated volunteers. We are 100% volunteer run. So like, Curtis is ending and Curtis is all up in this month. Proud of you, brother.
No, I say, you know, when we think about healthcare, partying and celebrating, commemorating, and this like really being festive is a part of healthcare. And that's what we really found ourselves on in Blue, is really making sure that we have that social engagement happening around the city. Because typically 9 out of 10 times when folks go to different areas to celebrate this within their own, is little, I keep on saying this whitewash word, right? Because we are what we know to be true in the city of Boston. There we don't have spaces that BIPOC led and driven. And so, yeah, you know, we got to do what we got to do.
Yeah, so definitely check out you know, Urban Pride at the end of the month. I know that they have a health summit coming. So just wanna plug that in there too. I'll come back in the questions and talk about it. But I do see before we get into some of the questions, I do see a hand raised. So I just want to give a moment for Karen to ask her question. Karen, feel free to
Hi.
unmute if
Hi, I'm Karen. I was wondering, do you guys have a newsletter or magazine or something like that into play? Because I was at the parade at the Commons and I was getting out to our magazine that caters to the community. And it has everything in there that no one will be turned down, you know. So like if someone called and said we don't cater to the LGBT, no, they have everything in that magazine. So I wanted to, do you guys have a magazine that, or maybe you can get a page in that magazine?
Boston
Great
Pride,
information in there.
Boston Pride for the People has a newsletter, and I can drop our website in the chat so that you can have more information. Curtis, is there anything you'd like to share about Blue's newsletter or information to get connected?
Yeah, I will definitely share our website again. You can go follow us and then also sign up for our newsletter as well, which we have a lot of different great information in our newsletter to share with the community.
yes, and we'll be sure after this event, you know, we always follow up with a whole bunch of links and resources, and we'll make sure, just in case you don't get it here, we will send it out to you afterwards.
Thank you so much.
Yep, no problem. So,
Hey, Curtis, how you doing, Curtis? This is Maria. We're gonna do stamps this year. We're gonna do SNAP program at your program
Hi,
this year.
Maria.
Hi.
I told you this
How
is like
you doing?
family.
Yeah, Denise is not here, but are we gonna do the SNAP program with you? We got it back this year.
I'm happy that it's back, and I think it's really important that we do bring it back into the fold. And I will definitely send you my email so we can connect offline and really make sure that our team bring you back as a vendor. Absolutely.
Okay, good seeing you. Thank you.
Likewise.
Fantastic.
This is like family. I told you, Ayana.
yeah, look, this is, like I said, community convos every month. It's the same folks. It feels like talking amongst friends and family. So yes, I'm happy that you're a cousin. You're a Vital Connections cousin now. So so one question I do want to pose to you all. This is kind of like the one I kind of start off with, because yes, we know about the work that we all do and you know, professions, things like that. But I just would love to know, and for you to share with the group what your why is. What brought you to the space you're in today? What was kind of like that aha moment where you were like, this is what I'm called to do? And it's okay if you're still figuring that out, right? But just would love to know what your why is.
I love this question, and I also think it's fluid for me. So I'll share what it is now. And I don't know, come talk to me next week, next year. It could be different. We could do this again next June. So my why now, I've always known that I enjoyed helping people. And I started off aspiring to do that as a doctor, specifically a pediatrician, because I love having fun and I loved the idea of creating a space where young people could feel safe in becoming better. Um, and I remember while I was in college, I had the opportunity to travel to South Africa and Eswatini, and I saw people unable to get what they need because of where they lived and because of what they had access to. And we see that in the US here, but it was louder. I could see it so much more in another country outside of the US. And I wanted to do something about it. And I started wondering if I could really do it in the way that I thought of in being a doctor. And that's when I got exposed to the language of public health. I hadn't heard that. I didn't know what that meant, or like what I could be in that. And as I learned more about health and what people needed to get the health that they needed, I also realized that part of people getting the help that they need and what they need to get that access to that was people um people being seen in all of their identities and experiences. And what helped me see that was like seeing how important that was for me as an individual. I went through I mean, we all go through as evolution as human beings, but just within the past 10-15 years, I really felt like I've evolved as a person. And by that, I've gotten to know who I am and have felt comfortable in who I am because of the environments that I've been in. Being able to work at Fenway Health has helped me discover and feel more comfortable in who I am. And it's helped me realize more of what I've been landing on. My mission is now helping people through creating spaces where they can see themselves and get access to what they need. One, because it's a journey I went through myself. And two, I enjoy asking the questions like, who is in the room? Who is not in the room? What do you need to get to this place that we are in? I love asking those questions and being in spaces where we're working through those questions. So that's what has brought me here. And that has been through the support of so many different people in community asking questions of me. I'm thinking about Curtis. Oh my goodness. I remember when we first got introduced to each other. Man, Curtis was holding us, Fenway Health, accountable heavy. Like, we started as partners on the Black Boston COVID-19 Coalition. And I remember, like, there was a meeting I missed, and there was someone in that meeting that was asking questions about what you all do, what's planned. And they were like, can we give you all exchange contact information? Curtis called me. So what are you all doing about COVID? There are high levels in our community. I see you doing research. Like, what, like, charged me up in the most beautiful called in way. And like that just goes back to like what I love to do in this world. And it's attracted me to people like you all who do work in the same way. So thank you for the question. That's the answer right now.
Come back next week, you said, right?
Yeah.
That means it's a journey if it always changes, and that means that you're constantly growing. So that's a good thing. So Curtis, what about you? What's your why? How'd you get here?
I think for me, working in different sectors, that's the first thing, right? Understanding homelessness, understanding youth engagement, understanding different facets of the work. And I think that when it really hit me was when I was working at Boston Medical Center under the supervision of Dr. Thea James. And my job there was a violence intervention advocate, in which we worked with folks who came in with gunshot and stab wound victims. And I was working with a lot of trans community members that was coming through our doors, being stabbed out there on Mass Ave and really being victimized. And it seemed like the doctors were treating them like ish, right? And I was like, this can't be the truth. This can't be our reality. And so I went to Dr. James, which I totally appreciate her still to this day. She's like my mentor. And I said, Dr. James, what are we going to do about this? This can't be our truth. This can't be our reality. And that at the same time, they were opening up a transgender clinic specifically for our transgender community members, but also Dr. Thea James charged me with, well, Curtis, if this is what you want to change, how do we change it? And we started a trauma-informed care curriculum to offer it to the physicians at Boston Medical Center because it was such a culture disconnect. Right. But then that wasn't the only disconnect for me. Like navigating through the community where I came from, being from the hood, from the projects, JP all day. I'm like, gang, but I don't want to go there. But but navigating through JP, growing up in urban communities and really not having access to certain things that I should have access to also was a move for me of my why. And I think that as of today, my goal to today, as we started our foundation, was to create space for Black Pride. And as I was going on a journey to reclaim Black Pride, we started having community conversations with our queer Black and brown folks, and they kept on saying all the things they're not getting access to being Black and brown and queer. And, we talked about intersectionalities, and there were so many intersectionalities that was showing up at these meetings. And I was just like, to our deputy director, Ela Keisha, shout out to her, who just conceived and had a baby. But I said to her, I said, we just can't do Black Pride without making sure that we're doing something else to make sure that our people is getting serviced the right way. And so we came up with this agency, and it's just not just an agency, guys, because you heard Adrianna say, we sat at the table, listened to some of these conversations and saying, and we really was pivotal at the peak of COVID-19, as she explained. We started our agency in 2019, and I can honestly say that we are a trusted resource in our community today. And that's my why, making sure that I put community first each and every time, and making sure that I speak up for the voices who are not able to speak up for themselves, and make sure that we're keeping all these institutions and city officials and all these other players accountable, because they have a duty to serve us. And if we're not at the table saying this is what we need, then we're losing sight on something. So that's my why. I stand up for community each and every day.
Awesome. Thank you. It feels so refreshing because I know that I talk to you all and we talk about like the health initiatives that are going on in Boston, but I think it really, it's always good to kind of know like what gets people going. So I just really appreciate you kind of giving us like a little sneak peek into your mind and your heart. Because like I always say, health work is hard work. So you got to love it to do it. So appreciate you sharing. So with that, and I think Curtis, you kind of hit on this with your statement. From your two vantage points, one leading a community organization and one working at a health center here in the city. I would really love to kind of, from your point of view, understand what do you think the current state of LGBTQ health is in Boston? And what aspects are Boston, as a whole doing well? What do we as a city need to improve on? And I understand that's very layered, it's very dense. There's a lot of identities when you talk, especially with the presentation that you shared, Adrianna, when it's not just about your orientation or your gender, right? There's so much more that comes into how care shows up for the individual, but just would love to know, what do you think of the state of LGBTQ health here in Boston?
I think we're getting better. That's my first thing. I think we're getting better. I think that we're sitting at tables with folks. We're sitting at tables together, right? Because I think that if we think about institutions sometimes are working in silos for their own mission, for their own sake of their own good. But I think that currently there's a lot of institutions that I have seen are inviting queer leaders to the table and asking queer leaders what they see is the challenge, what they see is the success, right? And I think that also is all about how do we go back to the old school education piece or the old school outreach, right? Where we don't see outreach workers at clubs no more, and which I think they need to be at clubs, right? That's prominent when you're queer, you're enjoying life, you're turning up, having a good time. I think that that's important, that we go back to that old stage of outreach and making sure we're outreaching where folks where they're at and how they're showing up. I think also we do actually with Fenway Health, we did a walking one stop one time. And so when I think about healthcare, I think healthcare just can't be in our institutions, but we have to be knocking on doors and inviting people into those conversations who may not know it's happening around them, And I think that, as we begin to sit at these tables with institutions and begin to tell them what's working, what's not working, what methods to use, I think that it's important that we continue to sit at those tables and we continue to bring people in, and especially younger people in, because I think that we're getting out-aged, and I think other young people need to sit at the tables too to actually ask them, how do we engage that population? Because there's a huge population between 14 and 18 that we're not engaging with effectively, right? And so we need to figure out what are those ways that we can engage with the populations effectively. But I think Boston's doing good. I think we could do better. And like Adrianna alluded to earlier, there's so many scales of advancement that we just can't tap into right now, but there's so many scales of how we can advance transgender health, how can we advance non-binary health, how can we advance bisexual health, gay health. Like there's so many ways and so many intersectionalities that we could talk about. How do we engage those populations? Because there are populations missing, as I just identified. The bisexual population, male population is missing, right? And how do we engage that population who's coming out, who's around, but just don't want to show their identities up, So we have to figure out ways to include everyone in the fold.
Absolutely. Can I comment on that as well?
Yes. Yep, I was just about to throw it to you.
Yeah, thank you. I really appreciate you sharing that framing, Curtis, because I was thinking, like, from my perspective, we have the care and resources needed exist. What has been missed is the lived experience at the table, which is now at the table, to inform how we use those tools, to think about, okay, what approaches have we shifted from that might be more helpful? Like maybe we do need to go back to walking in the community. Maybe we need to think about what are these enclaves in different communities, whether it's the corner store, whether it's the barber shop, whether it's the pizza shop that people pull up to on Friday. Like, what are the spaces that we can, and you won't know that unless everyone is at the table and you're constantly evaluating who's at the table today, tomorrow, because it evolves. So it really requires us coming together and being informed, like saying, what don't we know in this process? And what we can do. So I think really those spaces of coalition exist. Those conversations are happening. They need to continue to happen. But I love what I'm beginning to see in the city of Boston. I'm beginning to see alignment. I'm beginning to see awareness. By that, I'm beginning to see people saying, not everyone has access to what I have access to. I can go on my phone and schedule an appointment right now. I can have my tooth chipped and be somewhere this afternoon. And someone else does not have that same capability, either because they don't have insurance or they have to be on the bus. They need to look for childcare, or they have a racial identity that systemically causes disadvantage. There are actually people coming to that awareness. And like I used to be met with frustration. But now I'm like, I'm gonna be real, like, hello, like I've been living it, like, how are you just seeing it? And now I'm just like, it's my own like growth in recognizing we are in different places. If you have lived a reality in certain identities, especially identities of privilege and power, you're not gonna get it, period. In the way that others may, having lived experience in having marginalized identities and experiences. So I've developed some grace and understanding that everyone is in a different place of awareness, and creating spaces that can hold a spectrum of awareness and maybe even affinity spaces for people who are having lived experiences are needed. But I'm seeing those spaces created. There's even like sitting in this conversation right now, I'm like, what more can we do to like enhance the spaces that exist to make it more productive? But yeah, those spaces exist. And I think there's more that we can do to deliver on our shared mission and goals.
Thank you for that. And I know, as you know, as a part of the Vital Connections team, we're really intentional about connecting those dots, right? To bring people together to make sure that we're streamlining the great work that's happening in Boston. So we're no longer silo city, as I like to call it. And we're actually making an impact. And I think conversations are one of those like essential ways to make sure that we're sharing information and getting the word out there and knowing how we can just like have conversations about things. I know culturally, some of us are raised not to ask questions. And specifically with the lens of this topic, I know a lot of folks don't know either how to ask questions about identities or gender identity or sexuality, or how does that play into health and healthcare, even though we've got historical moments when we're talking about like the AIDS epidemic and what care looked like and how some people's biases are still trickling into care today, right? So there's a thread there, but I know we don't get a lot of time to at least talk about it, right? To get that first step to know, okay, this is what I'm thinking. How can I move beyond this and move it into action? So I'll say, as your health equity cousin, I'm here to make sure that we continue to work together beyond this conversation. So thank you for sharing your insights.
You said something, Ayana, too,
Yeah.
that I want to really speak on, because you said educating, right? And education is health, right? And I think that this conversation today is an educational conversation that actually can trickle down into how people navigate with queer folks within their family households now, right? I heard people say, what is pansexual? I heard people asking these curious questions which they never knew before. So I think that as long as we're informing them, they're able to walk away with more knowledge to be able to serve the queer community a little bit more, with a little bit sensitivity and moving and intentionality moving forward.
Yes, definitely. So I see that there's a question in the chat. I'm going to kind of put it together with a question that I had, right? Because we understand, of course, when we look at the data, I like to say water is wet. Sometimes we know certain folks experience more gaps in care and access, and all the data that we see everywhere, right? Would love to know, besides kind of like the connectivity and trying to build these relationships, having these conversations, what do you think is the action step that should follow when it comes to closing these gaps? Because we understand that that it's not just in health, right? Or not just at the doctor's office, I'll say, because we're talking about it shows up when it comes to access to insurance, your public accommodations, even to if you play sports, where you compete, how you compete, your self-expression, how you navigate the world, right? I know we're central to health, but I just think about it in that bigger lens, right? It really dictates the way that you navigate the world. So what can we do beyond these conversations to kind of push the needle into action?
I don't mind going.
Either one. I see two big smiles.
You can go ahead, Adrianna, because I'm over here thinking like there's so many things that we can do. But go ahead, Adrianna.
So a theme that has been, or like there have been a couple of themes, but something that I've been like really taking in this year is curiosity and feeling really empowered to be curious. And so earlier, when I was talking about Fenway Health and our acknowledgements, I talked about racism, which is a system that came into this world before any of us. I mean, maybe there are some like 1,000-year-olds out there that I don't know of, but like came in way before any of us entered this planet. This system of advantage and disadvantage came into play. It exists. It has informed our policies, like our structures, our systems, and anti-racism is like actively disrupting and identifying those policies, those systems, those norms, those structures that have been informed by that. So I mentioned that. I also mentioned the dominant cultures that exist in our world. Our world was created very heterosexually, very binary, like male, female. Like there's so much along the spectrum that is human that doesn't exist in the dominant identities that we exist within. And so when I say curiosity, I think it's really important to think about, to like be aware of our own experience in the context of the dominant experiences and the non-dominant experiences. Example, I did a presentation last week, and as I was preparing with the presenters, I mentioned like, does anyone require ASL interpreters? I was doing an activity where people were invited to raise their hands. I'm like, will everyone be able to raise their hand? I was thinking, okay, these are my dominant identities. I can hear, I can speak, but like those identities, those expressions within myself are dominant. This world was created, not out like our country, I'll keep to our country, though I feel like it exists outside, was created primarily for people who can see, who don't have mobility challenges or have mobility needs. Like there are um dominant identities and experiences throughout our culture. So things that we can actively do, something you can do today is just think about like what may be outside of your own experience. So one example I'll give, and pass it to Curtis, is, in this time beyond COVID, we've been on Zoom a lot. And like, I am like, I'm just grateful that people make the time and space to be in Zoom space with me. You could be on audio, you can be on video, you can be in your car, drive safely, but you can be like, I mean, I have talked to people in Zoom meetings in different spaces. There is a like etiquette though. And I would question where that etiquette comes from and what culture is informing it. But there's an etiquette of, being on Zoom. And I know I'm wearing this like, fashionable or whatever thing, but like, it's just, I was trying to look cute for y'all. But like, there is a way to present. Like, there's a reason why I didn't show up on my bed, but why not? So I'm constantly questioning what societal system is informing my actions and decisions. And so when I'm in Zoom meetings, I've had people only acknowledge people who come on video, which is very othering. Like, you don't know why I'm not on video. Maybe I don't have the energy, but I have the energy to join and I still want to participate. So I try and engage people in different ways. You can write in the chat, you can unmute. Have loved how y'all have come in here like, hey, Curtis, hey, like, feel free to do that. That is us. And we set the tone in the culture. And so I would just invite us to be curious today, and also challenge what you think the status quo is, because who made that? Now pass it to you, Curtis.
No, the first thing I think of is trauma, right? I think that some of us who was born like in the 70s, 60s, have this ideology of what we are supposed to be, right? And I think that the world is advancing so much that we have to catch up, right? And so when I think about the question, I think of gender expression. And the reason why I don't know why I'm on gender expression, because I think that it's so important that our Black and Brown and Latinx community knows that just because I might have a skirt on today doesn't mean I want you to call me a girl, right? It's something called gender expression, and I think that is so important that we know what gender expression really is, and that just because I wear a skirt or a dress today doesn't mean that when you see me, be like, hey girl, no, still call me Curtis, right? Just because I'm expressing myself this way doesn't mean I want to be called a certain way. So gender expression is really important. And we have to normalize that. And we have to get off this out of this thinking place of, oh my God, that's just totally gay, or our mindsets just goes to our foreign place, right? And so that's the only thing I gotta say is that gender expression, I don't know why I'm here with this gender expression piece, but gender expression is really important within our Black and Brown communities, and that we know that is different between gender expression and gender identity. I mean, so it's important, gender expression. I'll turn it back.
You shared that because when you said gender expression as an example that's really on your heart, I was thinking like assumptions. Assumptions can be so harmful.
Mhm.
In some ways, the individual who is making the assumption may be like, look, I'm just trying to figure out what you are.
Yeah.
So like that experience exists, and making an assumption and saying, oh, well, so-and-so is wearing a skirt, so obviously, no, ask so-and-so. And if you don't have a relationship to ask, or like if you don't feel comfortable, that indicates work that you need to do. But like the approach is ask. Well, I asked last week, ask again. If you saw something that made you question, but they said this last week, but I'm seeing this.
Yes,
That means that what you saw doesn't equal what you're assuming, and you need clarification. And I think it's also feeling empowered to
That
seek
accountability piece too.
clarification. Like I like taking it back specifically for like people of color, specifically for Black people, like thinking back to slavery, like we were brought up in a culture of like not feeling empowered to ask questions, to
That
what
part.
we see, to accept what we see. So as much as we're encouraging people to like clarify and ask questions, like you mentioned trauma before, some of the things that we see manifest in our communities that might impact their ability to be more open or like engage with different communities like LGBTQI plus communities with care is like historical generational trauma. And we have the opportunity to heal that by not making assumptions or doing the inner work that we like. Inner work is challenging. Like
It is challenging.
sometimes it feels good. You go like, ooh, you know, I've grown, but it's a journey. So I just thank you for giving that example of gender expression, because it's something that I've seen in our communities like associate a lot of assumptions. Someone's like, oh, so and so looks like that, so this is, and there's really an opportunity to get to know someone and not look at them and judge who they are.
And it's so funny you say that, because you talked about inner work, Adriana, and a lot of organizations that I work with that do trainings for are doing that inner work, right? And I just want to, I don't know if it's okay if I shout them out, but Children's Services of Roxbury, it's doing that inner work, right? What is it? I forgot the name of it. But anyways, there folks are doing the inner work. Organizations are doing the inner work, especially in the inner city, because they're seeing that a lot of folks, LGBTQIA plus, are showing up at their doorstep asking for care, asking for services. And the first thing they said to us was, "Well, if someone dresses like this and they walk in there, what do I do?" And I always say, "Well, wait for them to greet them, say hello, wait for them to write their name down on the log, and then greet them by their name that they put on the log, because that gives you identifying clout to say, hey, Curtis might have a dress on today, but he wrote Curtis, so I shouldn't call him no more than Curtis that he identified as," right? So I think a lot of institutions and a lot of agencies are really trying to get to a place of advancing their work within the LGBTQIA spectrum. And so, and I shout out Children's Services of Roxbury all the time, because even with their new employees, they have us coming in their new employment orientations and doing this work with them, talking about pronouns. What does pronouns really mean? How do we respect people's pronouns? It's a foreign thing. It is a foreign thing. I don't want nobody to think it's not foreign. It's a foreign thing, because even our elders of color of LGBTQIA experiences like, what is this, right? This is something that's being reintroduced to folks. So it's like, going back to what you say, Adriana, having curiosity, being curious, and know that you don't have to, you can make mistakes, but learn from those mistakes and grow from those mistakes, because those mistakes are going to help you later on down the line.
Yeah, and I want to add to, I'm really jiving with this conversation, just to add to what you mentioned, Curtis. I was thinking about this the other day, because pronouns has been something that has empowered a lot of people, but also have brought like anxiety to a lot of people. And I mentioned curiosity has been something that has been on my heart this year. And I've been curious of what is happening inside individuals who are anxious about pronouns. It has felt very freeing to me. And I just wanted to understand like what is happening. And I thought about that this morning in the shower. That might be TMI, but I get my best ideas there. And I was just like, has any of you, like either on the meeting or Ayana or Curtis, driven in a country where like the cars are on another side of the road? So for example, I'm Jamaican. And so like here in the United States, we're driving on the right side of the road, but in Jamaica and other places colonized by the British, you drive on the left side of the road. Has anybody experienced that difference? What was that like, Curtis? Like what, maybe it was fine for you and I'm projecting, but can you share what was that like?
No, it is kind of like, awkward. I wouldn't say weird. I think awkward is the word I'll use. It was kind of awkward. Like, oh my God, they're driving on the left-hand side. Oh my God, we're gonna get hit. Are they coming down the road? It felt new, right? It felt new. It felt different. It didn't feel normal.
Yeah, thank you for saying those. And I don't know if anyone would agree. I invite you to say that in the chat, or you can unmute and share that as well. But like, that's what I thought about for some people. Like, your whole life, you've known he and she. Like, maybe that was for 30 years, 40 years, 70 years, 80 years, 90 years plus. Maybe that's what you know. And there's now this new information being introduced, and you have to like process that. And I akin that to driving for umpteen years on one side of the street and then going to another country. I'm gonna just be real. There were some times where I accidentally went on the wrong side of the street. Nothing happened or anything, but just it's a process. And I guess I'm just saying that to invite you all to have grace for yourselves. We've lived in systems and ways and norms our
All
entire
right, I am not going back out.
Yolanda, did you want to share something? I know you unmuted, or unless it was an accident.
Oh. Did I unmute?
Yeah, I thought you were saying you felt the same too.
Oh, sorry.
No,
I was just listening. My apologies.
No, you're good. Nice to hear your voice. Thanks for listening. But yeah, it's just change can feel like driving on the other side of the road when you're not used to it. And I just wanted to offer that to you all to like give yourself grace, what you're feeling, any anxiety, like make sense. And it's, it's great to be in community with people who want to be curious and explore what it's like to be a part of a space where more people feel included.
Yes,
I love that analogy you just gave. That hi, I'm Pepper Rain. Sorry, how you Miss Adrianna?
Hey.
Yes, I just want to say that that's a great analogy because it's something different and new, and even people in the community don't know all the terminology and how to address one another. So people outside, yeah, you're not gonna know and don't assume. Like you say, because if I put on a dress today and you're looking at me, or you're a man, well, what do you call you? I said, my name is Curtis. Call me that. I'm Purple Rain. Call me Purple Rain. Or I'm Violet. Call me my name. Don't go making your own names. So your own assumptions. So I like how you say, like when I was in Jamaica for our trip there, it was weird. My sister was driving. I'm like, pull over, get over. And she's driving the way we drive in America. And it was scary. I'm like, so when she came back, she was driving the same way she was driving over in Jamaica. I'm like, no, push over. You got to remember, so like you said, it's not weird or, it's just different. That's the way you can put it. It's just different and something new to learn. And you're never too old to learn something. So thank you all for being here.
Yes. Thank you for that. And I know I've seen you before on other convos with Purple Rain. Thank you so much for coming back. But again, just one thing that, I think you hit the nail on the head on what I wanted to say, like, it takes time. So please, again, like Adrianna said, give yourself grace. That's why I said in the beginning, no question is a bad question. We understand that we're coming in a space that, of course, be respectful, right? But we understand that we're trying to shift gears, no pun intended, and figure out like how do I change my thinking to meet someone where they are, right? I know I've been taught this. I know it's been hardwired in my brain, but how can we kind of shift the needle? And I know that's what we're doing in the health space, right? That's why, when it comes to folks coming for appointments, right? How do we make sure that we're addressing the patient to make sure that they don't feel like they're being misgendered or looked at in a way that that they don't want, that the world is kind of putting an identity on them rather than them showing up as the entire person that needs to be seen and cared for, right? So it's like riding a bike. It takes a minute, and even if you might make a mistake, it's okay. Apologize, correct yourself, and keep moving, because it's muscle memory and it takes time.
And not to cut you off, Ayana,
Yeah,
like
go
go
ahead.
back to what Adrianna says, and Adrianna taught me cultural humility, right? Because I never knew what cultural humility was until I really went to go research it after she's talked about it so much. I was like, what is she talking about? But when I read it, and I was just like, wow, that does bring so much grace to anything, right? Because we don't know, and I stopped using culturally competent, because we're not culturally competent, right? To know enough about cultures enough that we can say we just know you, right? Because the culture, the individual knows about their culture more than we do. And so to be like, oh, I'm culture competent, I'm like, nah, I have culture humility now. Because I don't know too much, and I want you to teach me on my wrongs and my faults and my fails and teach me so I can learn and move differently with you. And so I totally appreciate you, Adrianna, for introducing me to that word and that terminology, because it really changed my trajectory of how I think and how I move around individuals. Because still to this day, I'm queer as F, right? And I'm still learning. I'm like, what? That's new. Put me on. Okay. Ballroom house. Okay. What about ballroom house? What about ballroom? I don't know about the ballroom house, but I have cultural humility around all my queer folks, right? Because I don't know it all either. And I'm learning as I go. And so, yeah, I appreciate you for introducing that word and terminology to me.
I appreciate you, friend. Appreciate you. And I just go back to like the dominant culture around us, like just to add to the grace that you all have, we live in a society that like is saying you should know all of these, like you should have competency. Like we are getting messages and images and things are shaped in a way where we feel like we have to know everything. So I just want to like put that out there. Like, it's not just y'all, like the world around us is like saying, you need to know, you need to know. Like, it's a fight. Well, like it doesn't have to be a fight, but like it can be challenging. I'm trying to like manifest positivity. It could be challenging or it could not be challenging. Here, expanded possibilities to, really be able to accomplish that. So I appreciate that you raised that and just always question like, why do I feel this way? Who has told me that I can't ask these questions? Like, feel empowered to ask questions and be curious. And also be in community. I think what helps me question, like what helps me accept what I don't know and question is being in spaces where other people do that too. That like, have y'all ever been in a space where like someone asks a question, you don't know it? Like, okay, here's this, like I've been in class and they're like, has everyone done the reading? And like, I didn't do it, but like, I'm not going to be honest. And then the moment someone's like, yeah, I didn't, I'm like, yeah, me too. Like being in community with people who like value honesty and integrity and like curiosity, it helps cultivate that in you. So I also encourage like be in community, which also value that characteristic as well.
Yes, thank you for that. And I also wrote down cultural humility. Thank you very much. Learn something new every day. I do see a hand raised, so I'm gonna call on Kareem. Kareem, feel free to come off mute and ask your question. How you doing?
Yes, hello, hello. Good to see all of you guys.
You.
Hey, Kareem.
Hey, Curtis. Hey, Adriana. Hey, Ayana.
Hey.
Hey.
And yeah, thank you guys so much for this conversation. I came a little bit later because I was coming from a meeting, but it was so great to just hear you guys share some of your experiences working with both the organizations and also just really how you navigate this space. And one of the things that really stuck out to me in this conversation is this idea of vulnerability, right? So no matter what identities we have, where we're coming from, we all are essentially entering this space together. So that communal piece you talked about where we're learning together, speaking together, trying to figure out if we do something wrong, how we can correct it for the future. All that's a part of that initial piece of being vulnerable in a space. So I really appreciated that. And I have a question too, but yeah. So my question to you guys is, in all this amazing work you do, I know you both mentioned so many programs that are happening both at Fenway and Boston LesBiGay. I'm wondering if there are like one or two things that you're really trying to push forward right now for LGBTQIA health, whether that's in policy, in the community, that you want folks to know about and potentially get involved in and tell others about.
I love that question. Curtis, would you like to go first?
No problem. For us, for Blue, we are at the table on advancing sexual health. And what I mean by that is there is a gap between folks going, I always call it over the bridge to bring to Mass General Brigham. And so we've been honored, I would say, to be advisors for the sexual health clinic at Mass General Hospital to advance the gap and fill in the gap between bringing Black and Brown Latinx folks over the bridge to get access to care in the sexual health clinic. And really, we started a community advisory board with Mass General Hospital Sexual Health Clinic on really bringing folks to the table to talk about why folks are not coming for care, what's preventing them from getting access to care, and what it does linkage to care looks like. And so really advancing sexual health, that particular sexual health clinic has been one of our main focuses right now. But beyond that, we're on a project. I don't know if I should speak about this, but Adrian, we're on a project together. Me and Adrianna and Fenway Health, we're on a project together right now where we're actually advancing COVID-19 and really understanding what is the impacts that folks have been facing with COVID-19. And we went through a first phase of this work with each other, and we got a data report that's out that's speaking to a broad population, targeted population. But what we did was we went back to the question of, like she's talked about, who's missing, who's not at the table, who are we not extracting information from that needs to be heard more. And so we're on phase 2 of this project with Fenway Health, and we're really trying to figure out who didn't get vaccinated, because vaccination it has been a hot topic in our community, right? And when I always said to Adrianna recently, I was like, we're talking about who didn't get vaccinated, but I felt like everyone was forced to get vaccinated. And we're not talking about how people was going beyond their will, beyond their religion to have to get vaccinated in order to interface with community. And so we went back and said, well, wait, we need to have that bigger, larger conversation, because folks are being forced to get vaccinated unwillingly. That's a conversation that needs to be happened, but that's data that need to be collected as well to speak to those long-term COVID clinic, long care COVID clinics and all those folks who do the work. But yeah, we're advancing COVID-19 health. We're advancing sexual health at MGH. And so we're tapped into a lot of different spaces and really trying to figure out like what's happening around us. And MPOX, right? We're not talking about MPOX right now, but MPOX is on an uptick right now, in which we are working with the Department of Public Health on figuring out a plan to start bringing more information to marginalized communities about MPOX and what this is doing, right? We're talking about MPOX, we're talking about COVID, but chlamydia is on a huge rise in the queer community. You know what I mean? And we're not talking about these things. So we're really in the trenches, really figuring out like, how do we translate this information that it's more readily ready for the populations that it need to be ready for. And the last thing is Gilead Health and Science. Like, we've been able to sit down with some of those folks over there too to talk about some of their pamphlets and information sharing that they're doing, right? We're like, wait, hold up. This doesn't make sense to us. Why are we not talking about Black and Brown community members in these pamphlets? And so we're actually going back to the table saying to them, rewrite your pamphlets and make it speak to the people that you're talking about more. And so, and then also we sit on the cab with Kareem too, on the advisory committee too with Kareem over there at Boston Medical Center, which is doing great work to advancing healthcare. So there's different ways that we're trying to advance healthcare with Boston LesBiGay Urban Foundation, but making sure that social and emotional care is number one at our state, because I think that if folks are engaging in social, emotional support and outcomes, will be easy to access, right? And so we're sitting at the table with a lot of providers.
I'm going to say a lot of what Curtis mentioned, so I'm going to add to and complement what you mentioned. So for one, we're seeing a high incidence. We're seeing a lot of rates of viruses within Latinx communities that are non-US born, as well as among Black women from Africa who are non-US born, in like MPOX, as Curtis mentioned, specifically for men who have sex with men who are coming from Latin America and living in the United States. And HIV from Black women have some of the highest incidence of HIV, but there's so much work that needs to be done to share the care and treatment in those communities. So that's a high priority. I also want to mention gender affirming care. Our care is built with a specific understanding of what a body looks like for any individual based on their sex assigned at birth. And that leaves out a lot of important questions and specialized care that a human might need if they live or exist outside of that binary male-female expression. Even within that binary, we so different. And then there are individuals who are intersex. And so gender affirming care, especially for young people who are understanding and discovering who they are, especially in a time where we have a lot of laws that are going through legislation throughout our country against the care that they need. Gender affirming care is really important. And then on the topic that Curtis mentioned, I'm really interested in really getting to this topic at Fenway Health, is this these initiatives around truth, healing, and reconciliation. And I'll give one example, but there are several examples in different communities that we can address. Curtis gave the example of really considering, what is the impact? What is the harm? What is the impact on trust in the community when when an individual has to choose between their livelihood, which is their job, and being vaccinated, something that they may have a fundamental disapproval of or have questions or like, what is the impact of that? We're not questioning how effective a vaccine or anything, but there is an impact when someone is forced to do something or forced to make a decision. And going through a process of truth, healing, and reconciliation is one, naming that that exists. Hey, yeah, you got that person vaccinated. They are still working at your place of business, but they now have higher distrust because they feel like they have made a decision that they had to make, or they wouldn't be able to secure housing or enter impact here. Name that, which is the truth. Heal that, really talk about like, what is the impact of that? What does that then mean when they go into their job every day? What does that mean when they go into their doctor's office that told them they had to be vaccinated or they would lose? Like, what does that do to the relationship between the community you're hoping to reach and their access to all the tools that they need to be a well human being? What does that do? And reconciliation, what can we do differently? I so appreciated this, Curtis, because I wonder, if we had thought about this question going in, what might we have created or done? It was like it was important for us for vaccination is an approach to decreasing COVID-19 that has research to prove it is effective. And it was something we were both making sure that people had access to, but that they also felt the freedom to make the decision that is best for them. And I just wondered, from like a reconciliation standpoint, what could the city, what could we as organizations have done for the community to provide a space of dialogue or processing of what it meant, what it felt like to feel forced to do something? And I see a comment in the chat of explaining. Could you expound more on what you'd hope to explain? Oh, Mpox vaccine.
Yeah, Mpox was, I was gonna jump in with that. But yeah, feel free just to, because I know that there were some terms that were used between the two of you, and I kind of want to just like kind of
break it down
for those moments, because I know for some folks terms have changed and some things, I want to make sure that everyone leaves this space clear. But could you just give a little bit more insight around Mpox and what that is for some folks?
Yeah, see, this is why I love space of coalition and holding each other accountable and supporting each other. Breaking it down, what we're about to do is one of those agreements on the list that I shared in the meeting where like we can create a space where we all feel included. So thank you, Adrianna, for giving us the opportunity to demonstrate breaking it down. Mpox. So Mpox, you may have heard in the news as the term monkeypox. Monkeypox is a viral infection and it spreads in a number of ways. We saw a lot of high cases in the LGBTQ community, specifically among gay and bisexual men, from sexual contact, but contact can be made through a lot of different mediums, but that's what we were seeing most through sexual contact and among gay and bisexual men. It was formerly monkeypox. It switched to Mpox because of the implications. If we remember, during the time of the HIV/AIDS epidemic, there was a lot of stigma and discrimination around Haitians and other Black communities in the world around them being the source of the spread of AIDS. And so having a viral infection called monkeypox, where the story was that a monkey scratched a Black person and that person brought it to, just the implications of that, the I was going to say the medical community, but was the entire community came together like, we should change this. And so that's where the language is now coming from, mpox. So you may have heard monkeypox, but it's now mpox. And I invite others, Ayana or Curtis, if you want to add to that.
Yeah, I think you hit the nail on the head. So thank you. I just knew that when I heard mpox, I had to take a minute too, because I was like, wait a minute. Is that what I think it is? So I did a quick Google on the side, which look, Google can be your friend.
It's
I know I looked to the side, I was like, oh, okay. But see, learning on the fly, right? And this is the space where, again, we hold each other accountable. We ask those questions. So thank you,
Also,
down and for
Thank you
chiming in.
very much. Because
Yeah.
if I don't know, I'm definitely going to ask.
absolutely.
Thank you.
Appreciate it. And Curtis, go ahead. I heard you.
No, I was just gonna say also Blue also worked with the congressional our Congresswoman Ayanna Pressley on advancing COVID-19 vaccine into some of our healthcare centers, which we had low counts of vaccines access. And so that has been a really huge moment for Blue in our work and advocating and bringing access to our community members. And what's a lot of like Dot House and other local health centers didn't have access to the vaccine. And we're like, well, these people go to these clinics. Why don't they have access? And so that's something that we pushed in legislation, which I just want to shout out, that your voice has to be at the table in order to make change happen, right? Especially our queer and trans community members, their voices have to be there so they can know what's for them and what wouldn't work for them, you know?
Yes, thank you. And then one more piece that I wanted to revisit with Adrianna when we were talking about gender affirming care. Because I know a lot of times when we get into that conversation, there is a lot that has evolved in that space when it comes to healthcare. And I do know, just for one, because I know I dropped in the chat a little while ago a glossary of terms that might help folks as we have this conversation. But I do know sometimes when we talk about gender affirming care, and I know a lot of times for, I guess, for like today in regular conversation, a lot of that comes around like transgender individuals, but you also mentioned intersex individuals. So I just wanted to give you a spot to kind of expand on that, to just to kind of make sure that we have a clear understanding of what, what gender affirming care looks like, including intersex folks, because I know that you kind of referenced them, and some folks may not know exactly what that is. So I just want to make sure that we kind of give the space to kind of expand on that.
Yeah, thank you for the space. First, I'll share what intersex is, and what I'll share too is, so intersex is having a variation of sex characteristics and or organs. And I also want to state that there are individuals who have variations of sex characteristics or organs. So for example, like you may be an individual that has breasts that grow out, but you may have may not have a uterus, or you may have specific organs that are associated more with an individual that was born male or born with male organs, but have other characteristics that may be associated more with a female. And so there are individuals that experience that. There's other language that you may be familiar with that are used to describe individuals that are born with organs that may be associated with other genders or expressions, but intersex describes someone who has a variation of sex characteristics rather than sex organs and sex characteristics that correspond to a particular gender identity or single sex. There are individuals who experience that and do not identify as intersex. They just identify of having a variation of sex characteristics or organs. And those individuals, both trans individuals who have a gender that is not the same as the sex that they were assigned at birth, and individuals who are gender nonconforming, so they don't identify as a particular gender, they identify more fluidly on a spectrum. And then there's intersex, as I mentioned, that might be an individual who has different variations of sex organs and characteristics. why this is important is because using an example, so a trans man, so an individual that might have been assigned female at birth, but their gender is man, that is their expression. They're going to a provider, and we talked earlier about the benefit of not making assumptions. By not limiting your understanding to what you can see, we recognize society has sometimes forced us to take it as we see it. We're inviting an openness to really be curious about someone's needs, and that shows up in healthcare as well. You may have a client or patient who's a trans man, and so if you're taking it as you see it as a provider, as an individual, you're like, okay, this is a man, and this is what a man has. You might not consider like, I have to consider if this individual might need some kind of reproductive health support. So maybe this person still is menstruating, or maybe this person needs to explore something else related to their care because they have a uterus. But it's not typical in the way society is framed in health spaces to think that someone who identifies as a man may have a uterus and may need to receive care as a result of that. And that's what gender affirming care is. It's looking at someone's gender and being open to understanding what their expression, what their expression is and what their needs are based on their organs and their being, rather than the construct of gender or gender expression, really just focusing on, hey, what do you need? What do you have? How do you use it? What can we provide to you to ensure that you get everything you need in your whole being? And so that is that gender affirming care, really curious and asking the questions about what someone needs to get the care that is best for them.
Yes, thank you for that. I just wanted to make sure that we leave no stone unturned. So appreciate you kind of taking a little deeper dive into that. I did see in the chat that we'd had a question. I know we were talking about just some other organizations who are doing great work. But I also know when it comes to, LGBTQ health, there's a lot of attention that is needed for our young people, right? So wanted to kind of pose from the chat if you know of any organizations that have a particular focus on, young people who are in the LGBTQ community. And I know in the lens of this conversation, if there are any like health resources or services that that cater to LGBTQ youth, I would definitely love to kind of give that a moment to shout them out, because we understand that we probably all have a young person in our life that we could direct them to these safe spaces.
The first one I'm going to say is Blue, Boston LesBiGay Urban Foundation. I got to shout us out. And the reason why I say that is because like I said earlier, we started a mentorship program for queer folks of color between the ages of 14 to 18 to really find existence, to really find belonging, but also to be matched with another queer leader that can really put them under their wings and really guide them through some of the channels that they had to go through in order to thrive in our community. But if I am going to shout out agencies that really service queer folks on all spectrums, I would say first being Boston Glass. Boston Glass is really a safe hub where folks can go there and get access to services and linkage to care to there and free mental health services. I would then say Bagley would be the next one for me. Bagley is another institution that they have drop-in centers, drop-in hours where they can get connected as well. And I just learned TTO, the Theater Offenses has a youth program that is geared towards 14 to 18-year-olds too. I was like, whoa, that's dope. I didn't know that. And so there are different other hubs too, like small agencies that might have other youth-driven programs, but those are the ones that I could think that really shows up in spaces that really works with young folks. Yeah.
But she was asking from 8 to 14.
8 to 4, yeah, that 8 to 14 still Bagley. I believe Bagley and Boston Glass still serve that population.
Thank you.
Mhm.
Those are all the organizations that I was going to share. And as you were saying them, both Kareem and I dropped the links into the chat.
Yeah, and I think, it's time to create more spaces, right? I think that's limited of space, if you ask me. I think it's time that we create more spaces for our younger generation can have access to some type of mentorship program. I think it's totally appropriate that we create more spaces.
Yeah, and one I know I would get in trouble if I didn't uplift. When it comes to the state, there's the Massachusetts Commission on LGBTQ
Yes,
youth.
yes.
They do a phenomenal job of empowering young people around a number of policy issues, and I know health is a part of their platform. So I'm going to add a link to the chat as well. And again, we'll share all this out at the end, but I know that the commission does great work with young people across the state. So definitely thank you.
If I could say this too, I really feel like there's a lot of Black and brown, and Adriana, please quote me if I'm wrong, but I feel like there's a lot of queer Black and brown individuals that's taking up leadership roles today.
There
That
it
was,
is
yeah,
LC.
that was once not the case, right? Where our director Brooks, Shapley Brooks from the Mass Commission on LGBT Youth, is the first Black female to hold that position, right? And so just looking at the evolution of the advancement of queer identities and how we're showing up in spaces and places is really advancing. And I think that it's for many reasons. I ain't gonna tap into the reasons. It's for many reasons that they're advancing us and making sure that we're in the forefront, because our queer identities ain't going nowhere, right? But also we're paving the way, and we're putting policies, and we're making space for the city to move and shape in different ways that they have not seen in a while. So I just want to commend all of our Black and brown leaders in queer spaces.
Yeah, retweet.
Yes.
Like rethreads.
Right. Yeah, so yes, just I appreciate that, because to your point, when we're talking about shifting the needle when it comes to these conversations and the impact of health in our communities, there are a lot of people who are stepping up and stepping into space to lead, that have the lived experience, that have been working in the community, that have that, that heart work and health work lens, that want to make sure that we're showing up for the folks that need it most. So thank you for definitely like shouting out those people and those organizations, because I definitely see the shift and the culture change that we were talking about from before. So yes, and if any other ones come to mind, and even if folks in the room, if you know of any, please feel free to drop them in the chat. If there's any resources that you know of, we're always here to make sure that we're sharing information, because when we talk about experts, no one can take away your lived experience. No one can take away what you know. I know that I've learned things in the chat from past community convos. So please feel free, if there are resources or things that you know of, please share them, because remember the community convo, you are the community. So just wanted to make sure that I uplift that.
I also wanted to, I know I didn't mention Fenway and our Borum Center, which is focused on care specifically for youth ages 12 to 29. So I will drop that in the chat as well as another resource.
Yeah, so one thing to kind of shift the conversation a bit, I know for us at Vital Connections, we try to take a look at community wellness, right? And I know a lot of time we talk about clinical care, making sure we have the nutrition for our bodies, that we're moving around, we're getting the things to make sure that we're physically well. But I also know safety, security, and mental wellness are very, very important to that holistic picture of what health looks like. As community members here on this call and beyond, what are some spaces, what are some needs when it comes to safety, security, mental health for the LGBTQ community? Are there spaces that that specifically cater to mental health? And how can we make sure that we're providing that safe space, because we already know, one, it's already intimidating to have that 15 minutes with a doctor. But when you're bringing all the other intersections into play, sometimes you feel like your health is more of like you're competing with yourself and the things that are, put on you. So just wanted to also offer that in the space. How do you feel about mental health, safety, and security for LGBTQ folks when it comes to the larger picture of their health?
I think it's as you described, in that when you talked about both needing to show up and be seen in your LGBTQI identity for those 15 minutes, plus all the other identities, I think of like this hill that we're all climbing. And I try not to like compare and do the oppression Olympics, but like fact of the matter is, like, as a LGBTQ plus person, plus other identities, whether it's race or income, etc., there is more that you have to consider. And so data actually shows that both LGBTQ plus adults and youth have poorer mental health outcomes. And a lot of that is having to navigate a world with less ease, having to navigate a world where the way you express and need things in life aren't the way that the world is structured. Like that, there's more stress involved with us trying to exist. And so by nature of that, there's more that needs to be addressed. And there are impacts to access. Like when you are living an experience or having experiences that are outside of the norm, sometimes it's harder to get help or understanding in the context of that. And so as a LGBTQ plus person that had, and we all have intersections, individuals, we are all intersectional. We like, even like I am Black, Jamaican, queer, like someone could have the same identities as me and still have a different experience. I'm just saying that to say, like, as people, we are so different. We are not a monolith. And in all of our differences and all that make up our being, that has had a strong impact in our community, in our LGBT community, especially youth who are trying to understand and discovering themselves and asking questions and trying to look for visions of what they might think they are or feel. That has been a strain on the community. I think a lot of work is happening and more needs to happen to make the support needed available in a way that our community can access it. But we see data across the country and locally of it impacting our youth and our communities in Boston, especially those that have to contend with a lot of different marginalizing experiences.
I think for me, I speak on one young person that I work with closely, and understanding that they can be themselves with me, but when they go home, they have to shut down their true queer self. And I always raise this person up sometimes when I speak, because I'm their voice, right? When it comes to advocacy, when it comes to standing up for those folks who are muted, them young folks who are muted and can't speak up and open their mouths, right? I'm their voice. And so when I think about mental health and well-being, I always go back to that social engagement,
Don't walk in there like they
right?
already know you, even though they do
I
treat it
go to
like
that
it's really
aspect
an interview because
engagement aspect only because that brings vibrity out of people. People get vibrant out of being around other people and cultivating space with other people. And so sometimes um, I have unclinical mental health conversations with people, right? They call me, hey, Kurt, I don't want to tap into the doctor, but I want to holler at you. And I love to have those authentic conversations, but I always go back to the point of, well, how about you just connect with this person too? Because I feel like Adrianna spoke about, there's not mental health services not readily available for individuals. And then you have to figure out, do I match up with that person? Do that person understands me? Do they understand my experiences? Do they understand all the intersectionalities that I come with? And if there's not that right person, you go into another person, right? They said if the shoe don't fit, figure it out, figure out what shoe fits. And so, but I say that to say that that process alone could deter people from wanting to get mental health services too, right? And so that's why I think it's crucial that we have agencies like Blue, like Bagley, like Fenway, like Boston Glass, that offer free services for mental health services, because I think that it lessens the scale of, or you're here to get paid or you're here to really listen to me. Because I think that when we do free for services, no fee for services, it creates a different dynamic with people and how they engage. And that's why sometimes, like I said, I have the off the record conversations with folks who are going through crises that just need someone just to listen, to navigate and help them out, to show them how to get to the next point or linkage to care, right? And so I think that we need to create more free mental health services, more mental health clinicians that we have access to. But yeah, that's what I would say, more free mental health services. But we really cultivate when it comes to mental health, like, yo, come outside the crib, come outside, come enjoy ourselves, come party with us, come be in community. And I have seen a turnaround. If I'm being honest, I have seen a huge turnaround with one of our mentors that's in our program, who's been just so isolated, and them now being able to be attached to a mentor. And we're having honest conversations with these young people, y'all. We're having real honest conversations. Like, I had a young person, I'm just going to give this little quick story, then we can go on. But I had this young person who asked us, and I'm getting like emotional talking about her, but I had this young person who actually invited me and their mentor to their senior project in college. And we went there, but this young person was so stressed out, y'all, that they broke down, right? And when they broke down, they were in the corner jumping and crying and hollering and hooting. And I'm just like, whoa, we got to get back there because she needs us, right? And when we got back there, we were able to have an honest conversation with the individual and say, listen, let's breathe. Let's get back on track. You got one more inch to go and you at the finish line. I'm getting emotional talking about it because it was that impactful. Because then I said to the mentor, I said, we need to have an honest conversation with that young person, because if we're not being honest with them to let them know they need to seek the services that they well deserve, they will still be, I won't say ignorant, but have ignorance to what they deserve and how they need to be, at what services they're eligible for. And so turn around 360 later on that day, the young person said to me, hey, Curtis, because I host an affinity group at RCC, right? We're creating space everywhere. We're going into universities. We're creating space. Like this, we need to create space, right? Because people don't got the space. We need to create it. And they ain't going to be created unless we create it, right? And so we're in RCC creating affinity spaces on every Thursday there. And the young person said to me, hey, Curtis, thank you for being there. And guess what? I got an A on my final exam. I said, there you go. There you go. I knew you could do it. But then I called their mentor because I try not to cross those barriers, right? And try to be very open-minded to listen to the information, receive the information, but go back to the source and say, hey, deliver, right? And I said to their mentor, I said, well, you need to let that person know that, one, they need to get some type of disability card or some type of disability act so they could actually flourish in their career, in their collegiate career. Because if they don't, then they're going to fail themselves. And two, you can let that person know that disability ain't nothing but a thing and you can thrive through it, right? Disability never hold no one's back. And three, that they're good, they're deserving of everything that's coming their way, that's successful and good. And so that changed that young person's trajectory totally around. And now they're excelling, they're doing great, and they're moving differently, right? And so, like I said, I have clinical conversations with young people, but I try to go back to the clinical side and say, you need to get the help and support, right? But they'll tell you straight up, there are, I don't want to say this like that, but there are pedophiles sometimes when you go to those service providers, right? Where their experience have been not so successful, where they went for care and the person tried to hit on them. And so we have to think of these underlying issues that really prevail themselves when they're actually seeking care, and why folks don't want to seek care. And that's their, like somebody said, that is very true, right? And that's their truth. That was that person's truth. And so when we're saying seek care, seek care, seek care, be mindful of what you're saying seek care of and do. Or make sure that it's I always say a soft handoff, right? Where, hey, Adrianna, I have a young person that could do some mental health counseling. Hey, do you have someone in your network that can assist that person, right? And know that they're a reliable source that we're counting on and connect them. And so, yeah, I just want to say that, like, our people are hurting and we have to give voice, choice, and decision making to them to know they can thrive.
That's so amazing, Curtis. I'm so
Yeah.
proud of you and all the work that you all are doing. I just to add to what you mentioned, what you exercised there, I think is so important with that student, with that young person. So, like, mental health, like navigating mental health, I'll speak in I statements, sometimes is uncomfortable. Like, it comes out in ways that don't look cute, like, it may seem out of character. And, like, when you are experiencing a negative impact or an outburst or a reaction, like, I have ran down streets screaming, like I have done the most, okay? And what can feel worse is somebody, there she go again. There she go acting crazy. You practice like I feel like I may have had an experience similar to what you described, stressed out about a presentation before in college. Like what you just described, that compassion for you to see how that individual reacted, and like your immediate thought wasn't stigma or judgment, like, what's wrong with this girl? You were like, oh no, that is so critical to support, is that compassion and that understanding and like lack of judgment. You know, the way not having good mental health can come out in different ways, and it's not our fault. It's not our fault. And what's important is to not react in ways or respond in ways where it feels like our fault. Because when we react in a certain way and someone reacts like, oh, there she go again, it just makes it feel worse. I don't even want to overcome, but like I'm gonna be worse. I just thank you for modeling that. And I know that's y'all always, that's how you operate. And thank you for putting that out in the world. And I think more of that needs to be shown in the world.
And we listened. I don't want to say that too. We listened, right? Because when that individual's in their moment, we let them have their moment, right? Where as a guy figure, her mentor said, Curtis, well, her professor was there and I was there, and her mentor said, the professor, you gotta go. Curtis, you stay. And I said, why did you say that? She said, well, you had a more soft, gentle approach than the professor. The professor was triggering her. I said, got it. But then as we sat there and listened to the individual speak, they were telling their story, right? Sometimes we're frustrated, we tell our story without even telling our story. And they were saying things that was just like alarming to me. I haven't slept in 2 days. I've been overwhelmed. The professor don't give a FUCK about what I'm doing. And all these things were their reality, but which really what I was seeing was not the real reality of what the reality was, living what we're in that moment, right? And so I had to go back to the young person and say, I think they do care about you. I think your professor does care about you, and he's trying to figure out the best way to work with you through this piece of challenge. But you have to be willing to open up and work with him too. And she's like, they don't give a F about me. I was like, he does. And everyone loves a good hug. So bring it in. Bring it in. And that's what we did, and we bounced back. And she had about 8 or 9 classmates inside that room while she was doing her thing and wilding out. And I'm like, let's bring it back. But we went back like nothing ever happened, and she accomplished her goal. I think it just takes that strive, right, to give people grace to act up, act wild, but bounce back too.
Yeah. Ooh. I'm
Yeah.
just taking all this in, I'm sponging it. And I just, again, I just want to show gratitude to both of you for like just being good people, right? And having good hearts and knowing kind of how to stand in, whether it be these large initiatives that you do or just standing in the gap for someone who's in crisis that needs it, just needs just love and support. And I just want to say I appreciate all the work that you all do from day to day, just as individuals. I just know, I know folks have felt it on this Zoom. If they didn't know you now, I know you have a bunch of new friends. So just wanted to shout that out before, because I know we're getting close to time. I just want to make sure I leave space for anyone that has questions, because I know we're kind of free flowing and kind of answering questions as we went, but I just kind of want to pause here and make sure if anyone does have questions that you can either raise your hand, put in the chat, so that way you could ask Adrianna and Curtis what's on your mind.
Well, UCB, we're a group big, excuse me, my voice just went. UCB, we're a huge organization. I know you all got a lot of upcoming events coming up, Black Pride and different things. And if you need volunteers, we're a huge organization. So throw it up in the chat or reach back out to Siobhan or anyone. Listen, you all doing amazing work. And listen, you already know, sign me up.
Thank you.
I'll put my info in the chat.
Miss Purple Rain, I'm gonna actually send you a DM right now and give you my my email and my telephone number. We'll definitely love the support that you can give for our Black Pride. Any support, we totally appreciate it.
All right, and now I see Miss Denise Palmer has her hand raised. Feel free to come off mute and ask your question.
Hi, I just wanted to say hi, Curtis. I remember down Dudley across from Simon's rather. We had a blast with
Hi,
you all.
Denise.
Hi.
Hi, Denise.
Thank you.
I heard we coming back this year, Maria said.
Well, invite us and we'll be there for sure.
Okay now. Okay, family.
That's
Okay.
right. That's right. I hope we didn't miss all the festivities yet.
Nope,
We need
nope,
you on the
nope.
UCB calendar, and
You
you
gotta be
need to get a
dancing.
hold of InFact so we
You're
can
gonna be
get back with
dancing.
you.
Yes,
Yes.
absolutely. I'll put my email in the chat for everyone as well, and hopefully we can link up and see what we can do. But Black Pride is around the corner, so yes, I'm excited.
You know, I had a ball. I came to the parties.
Yes, you did. Yes, you did. Yes, you did. And you met my mama. That's how close you became family.
Yeah. Oh, yeah. I met your mom. She signed up. She's
Yes.
cool. How's she doing?
She's doing very well.
Oh, well, tell her I said hi if she remembers me. Blessings to you guys.
Thank you so much.
All right. Anyone else? Have any questions before we close up for the evening?
I have a quick question for
Yeah,
Miss Adrianna. You said that you all accepting patients still. I'm looking for an eye place to go, because Boston Medical is booking out to November, and they called me. I just hung up on them. I just, I told the lady, no offense to you, but don't call me to book an appointment way out in November. That's not doing me any good. So, you all have appointments sooner?
We do have optometrists that can be found sooner, within 2 months. So did you get the link for the new patient? I'll drop it in the chat again.
Okay. Thank you.
For asking. Yeah, we have an optometry practice. Thanks for asking.
And I'll make sure that goes out in our follow-up as well for other folks, because I know we get a lot of questions around who's taking patients, things like that. We want to make sure that you have the most up-to-date information. But with that, I want to kind of, close us out for the evening. I know we've got a big game tonight that I know some folks.
Hey,
Go Celtics, go Celtics, go Celtics.
Right. I want to make sure you have time to heat up whatever healthy food you're going to snack on tonight. But with that, wanted to give an opportunity for the both of you to kind of close us out with any closing thoughts or words. Curtis, please plug Black Pride, because I know a lot of folks are talking about that, and I know Maria wants to go to the party, and so do I, especially that health summit. Would love to kind of get some closing information on that. And then Adrianna, if you want to close out with anything with opportunities for folks to follow up at Fenway, just want to kind of give you that space to do so. So, Curtis, I will hand it over to you, and then Adrianna.
Sure thing. Well, thank you, family, for having me this evening. Anna, thank you for bringing this to the forefront. And, like we usually say, all Pride but 365, happy Pride. So to talk about Black Pride a little bit, so June 29th is our Black Pride Health Summit. It's going to happen at the Bruce Boulin building from 11 to 3 p.m. That's going to be co-sponsored by Mass General Brigham. And then on July 2nd, we'll be hosting our Youth Black Pride, which will be held at Roxbury Youth Works, which is located at 301 Columbia Road. And that's going to be from 12 to 6 p.m. on July 2nd. And then July 4th, we on and pop it. I was going down over here, I heard. We on and pop it July 4th. July 4th, we kick off Black Pride, official Black Pride, with our Welcome to Boston. Please follow us on our Facebook as well.
Can I say something?
Yes, yes. I'm listening.
Here, Pam, go ahead.
Oh, I'm sorry. I wanted to thank you. You had something in the chat of what I meant. I'm glad you mentioned the pronouns because it's very helpful, especially in the kind of job that I do. I work for healthcare in Malden.
Nice. Pronouns is really important. I think that we have to come back with that one and really talk about what does pronouns mean and how do people identify with the pronouns. It's really huge, especially how folks identify in their own space and places. But yeah, like Black Pride, I put the link for our website. Please follow us on our website. Please follow us on Facebook at Boston Black Pride as well to learn about information and everything that we're doing in our community. Also, all of our initiatives on Black Pride website as well, all the things that we do in the city of Boston. I'll turn it over to Adrianna.
Thanks, Curtis. Just want to share just an appreciation and gratitude in you all sharing this space with us. We talked a lot about the work that we do, and you all are a part of this journey just by virtue of being in space with us today. Curtis mentioned the value of education, and I learned from you all. We shared something that you all mentioned you learned, and I'm inspired to continue being in these spaces with y'all. So it's not the only time you're going to see me. So just appreciation for being in community. And just a reminder, we both put in the chat some links for Fenway Health and our offerings, and they'll be included in the follow-up document that you all receive. But thank you. And I put my number and email in the chat if anyone has any other specific questions, but look forward to continuing being in community with you all.
Please come back. Please come back. We
I
don't
will.
got to tell y'all are welcome here, but if y'all need that to be told, y'all are welcome to come back here. So come on back. You're home. Come on back and be part of the family. Join and be a member. You can use my name as a reference, Purple Rain.
No, Purple Rain.
Thank
I
you,
really-
everyone. Have a wonderful evening.
I really
Good
want to
seeing
connect with
all.
you,
Yes,
Purple
thank
Rain, and
you.
see what we can
Thank you
do.
all.
Good night.
Thank you so much.
Yes, yes.
It's
Yes,
Yes,
wonderful.
everyone.
Curtis.
Yes,
Ayana.
everyone. Have a good night. Yes.
Ayana.
Yes.
Ayana.
Yes.
Can you give me an inbox call, please?
Yes, I did see your email. I'm going to follow up with you when this is done. But everyone have a good night. We'll be following.
Good night, everyone.
Great, great, great,
All
great.
right, have a
night,
wonderful
y'all.
evening.
From tonight.
Okay.
No
Have a blessed
infighting.
night.
Celtics.
Go Celtics! Oh.
Yes.
Celtics
Go
all day.
Celtics.
Yes.